Welcome to Career Explorer Northwest Live. My name is Tina Swanek, and I'm the Career Explorer Northwest educated producer for KSPS PBS Public Television in Spokane, Washington. Thank you for joining us today. Career Explorer Northwest Live is an interactive Zoom event that connects young people with professionals so they can learn about careers and career paths. Today, we're going to be learning about medical assisting careers with the help of a special guest from New Health. New Health is a federally qualified health center that serves residents of Ferry, Stevens, and Pend Oreille counties. The center operates 7 medical sites, 3 dental sites, 3 internal pharmacies, plus pharmacy home delivery, and a mobile clinic. Today, we're coming to you from New Health's medical clinic in Colville, Washington. Our special guest today is Noah Kitzmiller, a certified medical assistant with New Health. Hello, Noah, and thank you for being here to visit with us today and share information about your career and daily work as a CMA.
Yeah, thank you for giving me this opportunity. Appreciate it.
Also joining us today are students from Colville High School and their instructor, Brent Purvis. Might give us a wave. Thank you. And also students from Newport High School, along with their instructor, Katie Henshaw. Again, thank you all for being with us today. We really appreciate your time spending with us to learn about medical assisting careers. Before we get started today, I want to quickly share the agenda for our event. First, Noah is going to tell us a little bit about his journey to becoming a certified medical assistant, and also walk us through some of the tasks involved in his daily work. And then we'll open up the floor to questions from our student guests from Newport and Colville High Schools. Okay, let's get started with our event. Again, welcome, Noah. Will you please share with us your career path to becoming a certified medical assistant?
Yeah, so I knew that I wanted to go into the medical field probably when I was about 17-ish, and started my prerequisites through Spokane Community College, through Running Start. And then initially I was actually going to go and be a X-ray technician. And that was my initial path. And then life circumstances kind of threw it for a loop, but I know I still wanted to get into the medical field. So then I discovered the medical assisting program through Spokane Community College, which is a year-long program. And then did my externship through the program and then graduated, and here I am.
Okay, thank you so much, Noah. Can you tell us a little bit about your administrative duties related to your job? I see you're in kind of a desk environment there.
Sure. So when it comes to administrative duties, I do a lot of still patient interaction, but a lot of it is over the phone or mostly previewing patients' charts for information to prepare me on how to interact with them, whether it be in the exam room or for upcoming appointments. A lot of the times, or a lot of the time in the day is spent when the provider orders blood work. The blood work's performed, we get sent the results by the lab, and then the provider gives us a note that we then call the patient on. And that's my response. A lot of my responsibility is reaching out to the patient, or if a patient calls in with a particular issue outside of appointment hours or outside of them having an appointment, then relaying their issue to the provider and then relaying the provider's answer back to the patient. Some of it involves dealing with insurance companies. Mostly it's calling those insurance companies to figure out what is a holdup in trying to get their care. A lot of the times that's with prescriptions, or even talking directly with other pharmacies in working through minor issues in getting patients their prescriptions and that kind of stuff.
Okay, well, thank you so much for that quick overview of your administrative duties. I think it's fair to say that medical assistants need to be fairly detail-oriented and extremely accurate when documenting patient information.
Very. There, a lot of medical errors come from tiny little spelling errors, or in mathematical errors, decimal points being in the wrong spot, especially when you're talking about with medications, is a really big risk area for medical errors. So yeah, very detailed oriented.
Thank you, Noah. I see an exam room behind you, and I know that a good portion of your work takes place in the exam room. Should we move across the hall and you can tell us a little bit about the duties that take place in the exam room with working with clinical patients?
Yeah, let's do it.
So Noah, can you go ahead and just tell us a little bit about what kind of work you do, what your responsibilities are when it comes to working in exam rooms with clinic patients?
Sure. So I, as a medical assistant, I'm usually the first person that once you've checked in for an appointment, that is then interacting with you to figure out why you're in an appointment, to go over your past medical history, your current medical information. So like what you're taking as far as medications, your current allergies, family medical history, all that kind of stuff, and then bringing them, like I said, from the waiting room into an exam room like this. And then checking vitals is a big part of it, checking blood pressure, checking temperature, oxygen levels. And then I am kind of the liaison between the patient and the provider in getting them ready for the provider to then come in and see them for their appointment. And that whole process is kind of referred to as rooming, is kind of the almost jargon term that's used, especially among medical assistants. When they say that my specific assignment today is going to be rooming patients, it means grabbing them from the waiting room, bringing them back to the exam rooms and getting them ready for the provider to see them for their appointment.
Thank you. Do you have any procedures that you do in that room or activities that you would like to maybe demonstrate to our viewers today?
Sure. So let's go through taking vitals. So a lot of the things that I use on a very everyday to day basis is this little device here called a pulse oximeter, which is responsible for checking their oxygen levels, and then using my stethoscope or sphygmomanometer for those who don't know the medical term for a stethoscope, and checking blood pressure. So a lot of the times, once I've figured out what they're in here for, and then have kind of asked them some follow-up questions on what they're in here for, a lot of the times it ends with taking blood pressure, because the last thing you want to do is take blood pressure, give them time to relax in the room. And then it's a matter of checking their blood pressure and then making them as comfortable as possible, and then getting them ready for the provider. Sometimes it involves stalling in a very professional way. If the provider's running behind, I conversate with the patients, get to know them on a more personal level outside of just being a medical assistant, and kind of build that rapport with them. And then kind of in a way, stalling but not stalling to help the provider, give them a little bit more time before the provider comes into the room, kind of a thing.
Yes, medical providers, as we all know, are very busy. And I wonder if you could tell us, in terms of your workday, what does a typical workload look like for you? How many patients do you see in a day?
Sure. So for a typical family practice provider, which is the type of clinic that I've worked in, um, a lot of it depends on the provider's credentials. There's a bigger expectation for higher end credentials, such as an MD or a DO, to see more patients as opposed to a PA. But a lot of that number is ranging anywhere from 18 to 20 to 22 patients if you want to really, really make yourself busy. And that's on a day-to-day basis.
Wow.
If the provider's pretty new, that starts off a lot slower. But gradually, the expectation is that they build up to seeing that many patients. With the rare exceptions that I've seen, I've roomed a couple providers who saw 30 to 40 patients a day in specialty practices.
Thank you so much for that overview, Noah. And no more questions from me, but now we're going to start the question and answer portion of our event. As a reminder, we won't be taking questions through chat today. Students, before asking your question, please introduce yourself with your first name only. And let's start with a question from Newport High School, and then we'll alternate questions between schools. Newport, what is your first question for Noah?
Hey, my name is Caden, and I was wondering if is it difficult not to get too emotionally involved with the patients that you care for?
Hard to get, you said emotionally involved?
Yeah.
It is kind of, so to an extent, you're taught that there does need to be a clear difference between sympathy and empathy when it comes to interacting with patients. Sympathy being that you understand their problems that they go through in their everyday life. Empathy being that you yourself feel and relate in that way and bring it upon yourself. And they really teach you in school to, I mean, hopefully they teach you in school for becoming a medical assistant, that you're to make a very clear distinction, that to try and not bring that empathy on to show sympathy. The reason being is that you want to maintain a professional composure and a composure that and an air that you are there to help them and that you are a step in providing that solution to their problem. And so if they see you interacting in that way to where you yourself become emotional or distraught because of their issues that they've brought up, then it kind of provides a little bit of a barrier that, where they see that, oh my gosh, is this the guy that I want, helping me in my problem right now? Because they look to you as that first stepping stone, or like I said that earlier, that liaison between the provider and them as the patient in getting the solution to that problem. So to some extent, it's a little difficult. I do like still getting to know the patient, and a lot of the times you can do that in a very professional manner without taking their problems onto yourself. And that's not to say everybody's human. I have gotten emotional in rooms with patients when they were explaining some very difficult times. A lot of the time, it's still just making sure they're reining it back in and being that professional appearance to them. Yeah, it's. I wouldn't say that it's hard, like what your question was saying, but it's hard not to want to overstep what your boundary is as a medical assistant, where you have a lot of legalities that keep you, that you can't overstep that boundary, if that makes sense.
Thank you so much. Colville, what is your first question for Noah?
I'm Nia, and I just wanted to know what the work culture is like at different clinics.
Sure. So a lot of it, a lot of the work culture is determined by the company that you're working for. There are a lot of companies who take a very religious approach to their care and have that be at the core center of it. And so that work culture is going to be very, like I said, religious oriented almost in their work culture, as opposed to other clinics, private practice clinics especially, usually don't. They either do carry that religious component or they strictly do not carry that religious component. With New Health Programs being a federally funded health care center, we have to kind of follow those guidelines set by that federal level. And so the work culture is very just medical, so to speak. A lot of it is a lot of medical terminology and talking between people about just medical and discussing patients is a lot in the culture. I would say it's very professional, and there's a big strive for it being very professional in the medical field. Hopefully that answers the question there. That makes sense.
Thank you. Newport, next question for Noah.
Hi, I'm Christy. What will help me prepare for a career as a medical assistant?
Sure. So there is a lot of things. In fact, I would say any work experience at all is going to help prepare to become a medical assistant. Before working as a medical assistant, while I was especially getting my education for it, I was working at a ZIPS as my very first job. And after that, I was working at a place making pizzas. And so while maybe some of the technical skills really didn't help me in any medical fashion, that just learning how to be kind of almost diplomatic in dealing with customers or patients when you're in the medical field gives a lot of experience in that way. I was homeschooled before all of this, and so especially having those prior jobs really helped me kind of break out of my shell a little bit and get that experience socializing with people, especially dealing with difficult people, as I've learned is wherever you go, no matter where you work, in any position you are, you have to deal with difficult people. And the more experience that you get dealing with difficult people, the easier you can handle it, kind of a thing. Any kind of health related classes are going to definitely help getting that basic knowledge of the human body and how it works. I cannot tell you how much on a day-to-day basis I use just basic anatomy in explaining to patients certain concepts, in reading sometimes, because a lot of the times what I get from the provider has a lot of medical terminology jargon that I have to refer back to my education in learning medical terminology to then basically explain it in layman's terms to the patient so that they can understand, because they don't have that background in medical terminology to know what I'd be talking about. And I found very particularly in helping with medical terminology, any kind of class in either Latin or Greek, just a basic understanding of Latin and Greek has helped me learn medical terminology huge, because all of our precursor knowledge came from the Latins and the Greeks, and all of their language is still being used for that. In fact, I would argue I don't use Latin or Greek anywhere outside of my job. That's the only time when I use it is in my job. But I'm very thankful I took a couple Latin classes when I was in middle school, and a lot of it stuck and helped me understand in that area.
Okay, next question, Colville.
Hi, I'm Abby. I just wanted to ask what kind of benefits you tend to get as a medical assistant.
Sure. So it's going to vary depending on what organization you work for. Specifically here at New Health, there's retirement benefits, there's medical benefits, vision, dental, health insurance. We get paid on the job training, which a lot of other employees may or may not offer. We have the medical assistant apprenticeship program as part of that on the job training. So we take people who have either just graduated high school, who are in the company and are looking to further their career, and they get paid full time to learn the on the job training under like a medical assistant like me, and get paid while they're doing their school. We also get quarterly coffee days that any nursing staff is going to be appreciative of, extra caffeine during the day. And we even just had recently New Health program paid for all of its employees to get a Life Flight membership for not just us, but also our family members. And so that's huge. The cost of being life flighted is very, very costly. And so to have that already taken care of for you, it's kind of one stress that you don't have to think about. Yeah, there's a lot of, there's a big resurgence in mental health resources being paid for by employers, especially in the medical field, because of a lot of the job is very draining. And sometimes, like I said earlier, patients will tell you things that you thought you would never hear in your entire life, and you need to then talk to somebody about it. And unfortunately, HIPAA laws prevent you from talking about it unless you as a patient are covered talking to another licensed healthcare provider. And a lot of that conversation comes between mental health providers. So there's a lot of benefit in that way. Most organizations are offering a resource, whether it just be virtual or in-person counseling options for when you have stuff that you need to talk to somebody else about. So yeah, hopefully it gives kind of a general overview to benefits there.
Next question, Newport.
I'm Bree, and I want to know, when did you start considering this career and why were you interested in being a medical assistant?
Sure. So it all initially started with a personality test that I took and answered a bunch of questions on, and it said, you know, you might do good in a medical field. And especially with technology catching up to, or I guess the medical field catching up to the technology field is maybe a better way to say it. Being younger and having that kind of technology, like growing up with technology, I was like, I probably will be good at this. And so that is kind of how it all started. Like I said earlier, I was initially planning to go into X-ray technician, but at least in Washington State, it's a very, very competitive field to get into being an X-ray technician, more so than nursing even, to become a full RN or LPN. And so when I found that out and still wanting to get into the medical field, medical assistant is like perfect, even as a stepping stone if you want to go on to do further. But that was how I kind of made that decision to go into medical assisting. The program was only a year long. Some programs are a lot shorter. It just depends on what school you go into and kind of how their system is set up.
Colville, next question.
I'm Morgan, and I wanted to ask what the general salary range is and the possibilities for advancement.
Sure. So when I first started, it was a little bit lower. I think the wage for a medical assistant in Washington State back when I first started in 2019 was $16 an hour. Of course, everything else has gone up since then. With New Health, the current starting range is anywhere between 22 and 26, depending on your years of experience as an MA. Some clinics are going to be higher, especially if you're going into specialty clinics. A lot specialty clinics are just generally known to pay their nursing staff higher than general family practice clinics. Another option, any urgent care clinics, they pay even higher than that. But a lot of that, you're kind of trading flexible hours and a concurrent schedule for higher pay and like working weekends and stuff like that. So a lot of that area is kind of like a take and give depending on where you work. As far as opportunities for advancement, I have to renew my license every year. So there's kind of a recurring advancement in that way, like educational advancement. I have to earn continuing education units, and I have to earn 60 of those every 5 years to renew my license. So in that way, I'm kind of keeping up in knowledge with the medical field. But there's also specialized licenses within a medical, within being a medical assistant that you can go further on and get. Having a phlebotomy license, a phlebotomy technician license is really helpful. It just gives you a little bit more understanding when it comes to doing blood draws. And then also there is the ability to get a license for dialysis technician through being a medical assistant, and it allows you to interact with the ports that patients use in dialysis. I don't think it allows you to place them. That is done by a higher credential, but at least connecting said port to the machine, running through the whole process, and all of that is involved in that that credential. There's also a couple different nuanced licenses that you can get that allow you to operate different kinds of machines within your scope of being a medical assistant. Like I have the ability and scope as a medical assistant to take x-rays. I have never taken an x-ray, and so I would have to get a little bit of training in that area in order to take x-rays. There are specific like audiometry machines for testing patients' hearing that require a specific license and training to use. And so just little things like that that give you a better ability to be utilized as a better tool in being a medical assistant, or utilize those tools better in helping the provider get information for the patient in that way.
Newport, do you have any additional questions?
My name is Abby. What steps do you take in order to gain the trust and respect of your patients?
Oh, so tough question. There's a lot of steps. In fact, I don't even know if I would call them steps because it's a recurring process. Especially in the last couple of years, there's a lot of distrust from patients in the medical field. And so doing that isn't necessarily a step like getting that trust back for them, maybe not even to trust you, but just to trust the provider in what kind of care plan that they want to utilize for their patient. I can't tell you a definitive number of steps. A lot of it is interacting with them on a human level, because a lot of the push from in the last 100 years, patients being seen at their own homes, when doctors were going to their own homes and doing home calls basically and seeing them and providing treatment, they're at their bedside, to now you're going to a clinic and you have insurance involved and you have countless forms of paperwork and documentation, which is good and needed, but they're kind of, there's a lot of patients who look at they think they're being seen as a quantity over quality kind of care, with the push for the amount of patients that need to be seen on a day-by-day basis. And so treating them and realizing they're a human, giving that little bit of extra interaction with them in a room does millions for them. I cannot tell you how many times I've just taken like 2 extra minutes just to talk to them, like recently with it being the holidays. How was their holiday? Did they have a good time? Did they have any special plans? Did they do any traveling? That kind of stuff. Not only does it give them a calmer sense of mind in going and talking to the provider about their appointment, but it helps them realize that, oh, so you're not just going to do what you need in this room, get the vitals real quick and leave. You know, and I'm not just here to receive the services that you have to offer. I'm actually a person with problems that everybody may experience or everybody may not experience. And so building that trust in that way is a huge, huge step. So learning active listening in that way, I use active listening every single day. Am I good at it? Probably not. There's always room for improvement in active listening. But then also another step is just providing accurate resources to the information that you're giving them. There's so much disinformation online right now, and it's very easily accessible. And so just when they have a question, being able to provide them with very credible resources is huge also in providing that trust. It shows that you've actually done the research and what the problem they're bringing to you, and have a good answer that has been backed up by science to show the answer that you're giving. And some of that can happen with the medical assistant. A lot of it happens with the provider and the patient, but some of it can happen when I'm rooming them, just with my basic understanding and knowledge of like different resources with the CDC, the American Heart Association, all of those different resources. So that's what I'd say the two biggest things on how to build patient trust there.
Thank you so much, Noah. I think we're getting close to the end of our time. So is there anything else that you would like to add that you feel it's important for the students to know about a career in medical assisting?
Yeah, if one thing to keep in mind is that if you're squeamish, just know that you're going to encounter some very squeamish things coming into the medical assisting world. I do handle wound care, so picture the worst wound that you can possibly imagine that you've seen on TV, and I can guarantee you, you're probably going to see it in your career. And so, kind of building an iron stomach, and I do a lot of blood draws on a daily basis and deal with a lot of blood. Have I gotten blood on myself? Thank goodness, like protective equipment have kept that from happening so far. Have I stuck myself with a needle? Thank goodness it was a needle that had not already been in the patient. It was a clean needle. But just little things like that, especially like needles is its own separate topic. You got to be really comfortable being able to put a needle under somebody else's skin, because it's a very big part of what I do, especially during flu season. On a daily basis, I'm giving at least 5 to 6 flu shots myself. And then dealing with those people's fears and understanding that, getting a good knowledge of where it comes from, helps that way too. So just something to keep in mind. Yeah.
Thank you so much, Noah. We really appreciate you being able to join us today and to share with us all of this valid, very interesting and candid information about medical assisting careers. We'd also like to once again thank Brent Purvis and the students from Colville High School for being here today, and Katie Henshaw and her students from Newport High School as well. We hope, especially the students, that you found this session to be very interesting and informative. And we hope that what you learned today will help you to decide if a career in medical assisting is a good fit for you. And that concludes this Career Explore Northwest Live event.